So today we are going to discuss about papilledema. What is papilledema? It is the swelling in the optic disc due to raised intracranial pressure. So let's discuss. You can see in the picture there is severe papilledema in the left eye. You can see the edematous optic disc. So it is a swelling of optic disc due to raised intracranial pressure. When the intracranial pressure is raised, it will be transmitted to the optic nerve, and then the optic disc will show these swelling and edema will be observed in the optic disc. So now, clinical features of papilledema. It is usually bilateral in both the eyes. It will be there, except in Foster-Kennedy syndrome. It is an exception. In Foster-Kennedy syndrome, it will be unilateral. Then it is painless and it will be non-inflammatory. Since there is no inflammation, no pain, it is painless and it is non-inflammatory. Okay. Next is pathogenesis. The raised intracranial pressure from the brain is transmitted along the subarachnoid space. It goes to the optic nerve. It will lead to blockage of nerve impulse transmission in the optic nerve, and there will be stasis. That impulse will not be transmitted. There will be stasis, and it will show vascular signs as well as mechanical signs. That is mechanical obstruction and venous congestion. Now we will discuss the signs of both of these. Okay. So first is mechanical signs. Earliest will be because of that swelling in the optic disc, the margin will get blurred optic disc margin, and the optic disc will get elevated and the optic cup will get filled up. Then there will be edema in the retinal nerve fiber layer, and then we will observe Patton's line. What are Patton's line? They are retinal folds which you will observe around the optic disc. Some folds will be there. Those are Patton's line. So these are the mechanical signs of papilledema. The next is vascular signs. Under vascular signs, hyperemia and venous congestion, venous engorgement. Cotton wool spots will be there. Then hemorrhage, splinter hemorrhage on optic disc, and macular star appearance because of deposition of exudates on the macula. So these are the vascular signs, and those were the mechanical signs of papilledema. You have to remember these signs, okay? Then next is what are the symptoms. So symptoms are, first is earliest is headache. It will be worse in the morning. Then there will be associated projectile vomitings. Vision is normal. Papilledema will not affect the vision. But if complication like secondary atrophy occurs, then there will be gradual painless loss of vision. Then next is amaurosis fugax. That is transient visual loss for few seconds to few minutes, and then the vision will again return to normal. Then again loss of vision, then vision to normal. That is amaurosis fugax. It will be seen in papilledema. Then next is grading of papilledema. This grading as per the Friesen scale. And there are 5 grades of papilledema. We will discuss by one. So first is grade 1. Under grade 1, you can see that C-shaped halo around the optic disc. This is a C-shaped halo. In grade 2, that halo will become circumferential. That C shape will get circumferential. In grade 3, there will be obscuration of at least one vessel. One vessel will get obscured. In grade 4, major vessels on the surface of optic disc will be obscured. In grade 5, obscuration of all vessels on the disc and leaving the disc. Means all those vessels which are on the disc and leaving, all will get obscured. So we have 5 grades. Under grade 1, you remember, it is C-shaped. C-shaped halo will be there. And there is sparing of the disc margin, temporal disc margin, but there will be a C-shaped halo. Grade 2, that halo will become circumferential, and there is no major vessel obscuration. Under grade 3, there is obscuration of at least one vessel on the surface of optic disc. Under grade 4, all major vessels will get obscured. Under grade 5, obscuration of all vessels on the disc and leaving the disc. And all other features of grade 4 will be there in grade 5. So these are all the 5 grades of papilledema. Thank you.